Hey, everybody, welcome back to the Caregivers Collective, the podcast where we shine a light on the caregiving journey. We offer encouragement, information. Hey, everybody, welcome back to the Caregivers Collective, the podcast where we shine light on the caregiving journey, offer encouragement, information, and practical tools to help you walk this path with strength and grace. I'm your host, Tangela. Today's episode is all about something that touches so many families, yet is often misunderstood. Today, we're going to discuss Medicare and how it supports caregivers, especially when it comes to hospice and palliative care. So, what brought this about was that I recently attended a Revive and Refresh conference sponsored by the Dementia Care Warriors in a nonprofit organization located in the DFW Metro. And segment one of the workshop segments was uncomfortable for one of the work one of the workshop segments was uncomfortable for most but inevitable for all. And it was taught by Dr. Farhara Kassam, Kassam. And that subject got me to thinking about how important it is for all caregivers to face this fact. This, this session discussed hospice and palliative care. So today, let's talk about it. So we're going to dig into what Medicare actually pays for, how you apply for hospice, what palliative care really looks like, and the kinds of caregiver support that are built into these programs. By the end of this episode, you'll feel more confident about what resources are out there and how to access them when you or your loved ones need them the most. So, let's start with the big question that many caregivers ask. Does Medicare pay for family members to provide care? I know I had that question. Well, the answer is simply no. Medicare does not cut a paycheck to pay family members to be caregivers. But here's the important part. Medicare does cover services and supports that directly help you as a caregiver. Think about it this way. Instead of paying you directly, Medicare funds programs that brings in help, training, equipment, and even short-term relief so that you can keep going. Some of these supports include home health services if your loved one qualifies. That can mean that can mean nurse visits, therapy, and sometimes a home health aide. It includes durable medical equipment like hospital beds, walkers, or oxygen, things that make caregiving safer and easier. Caregiver training services is also included, and this is a newer benefit. Doctors can order actual training for caregivers so that you can feel confident helping with tasks like wound care, transfers, or feeding. Then there's the advanced care planning visits. Those are important conversations with the provider about future wishes and advanced directives. Of course, there's care coordination services that keep doctors on the same page, which really helps caregivers stay out of the role of full-time care management. And if your loved one is on a Medicare Advantage plan, that's the private plan version of Medicare. There may be extra caregiver supports built in, like some help in transportation or adult day services. So, if you're not sure what your plan covers, write this down. Call 1-800-MEDICARE or connect with your local SHIP counselor. That's the State Health Insurance Assistance Program. You can do this for free, unbiased help. Now, let's talk about hospice care. This is often where caregivers get overwhelmed because it feels like such a heavy decision. But when you know how it works, it can feel more like a gift than a burden. Maybe you're asking who qualifies for hospice. A doctor must certify that the patient has a life expectancy of 6 months or less if the illness runs its normal course. And the patient must choose comfort care, meaning no more curative treatments for the meaning no more curative treatments for the terminal illness. Maybe you're asking, how do you get started? First thing you have to do is talk to your doctor about whether it is time for hospice care. Talk to your doctor about whether it is time for hospice care. Then, of course, you'll have to get referred to a Medicare certified hospice. You'll then sign a hospice election form, and then the hospice team does an assessment and creates a care plan for you. From there, Medicare covers all medication related to the terminal illness. They cover all medical equipment like the hospital bed or oxygen related to the illness. They cover visits from nurses, aides, social workers, and chaplains. They cover respite care for the caregiver, up to 5 days at a time if you need a break. It covers bereavement support for your family for at least a year after your loved one has passed. And here's the part that gives caregivers peace of mind. There's a 24/7 nurse line, so you don't have to be alone at 2 a.m. when something happens. You can call and help will come. Maybe you're asking, how long does hospice last? Medicare pays for 2 90-day periods. Remember we talked about 6 months? That's the 2 90-day periods, then unlimited 60-day periods as long as the doctor keeps certifying there is a need. So hospice doesn't run out, if you will, as long as the patient is still eligible. So what's not covered? Room and board at home or an in-nursing facility. Treatments meant to cure the terminal illnesses are not covered. But if you change your mind, maybe you're asking, what if I change my mind? Well, if you change your mind, you can revoke hospice at any time and you can go back to curative care, and you can re-elect hospice later if you need it. So, caregivers, don't wait too long. Studies show that people often start hospice late and they miss out on weeks or even months of comfort, help, and support. So if you're not sure, call a hospice agency directly. They'll walk you through the process whether your loved one and determine whether or not your loved one qualifies. Another subject that we talked about at the conference, at the Revive and Refresh conference, was palliative care. This kind of confuses people. Hospice and palliative care both focus on comfort. But here's the difference. Palliative care can happen at any stage of a serious illness. You don't have to stop curative treatment. You can receive chemo and palliative care. Dialysis and palliative care. It's about relief from symptoms and stress while you are still pursuing treatment. Maybe you're asking, how do I get it? Well, ask your doctor for a referral to a palliative care team. These are usually found in hospitals, some outpatient clinics, and even some home-based programs. Medicare Part B pays for the doctor's or nurse practitioner visits, counseling, and care planning. If equipment or home health is needed, those may also be covered. For caregivers, this means that you get a team that helps manage pain, anxiety, or shortness of breath, and who helps you to navigate the hard choices. It's less about end of life and more about quality of life. Now, you've heard me mention curative care earlier, and now we're discussing palliative care. And maybe you're asking yourself, what's the difference? Well, curative care aims to cure or resolve either totally or partially a condition or a disease. Treatments used in curative care are also used to delay disease progression. Say, for example, curative care treatments might include chemotherapy or radiation for cancer, dialysis treatment for kidney failure, or antibiotics for a bacterial infection. This type of care may also be referred to as therapeutic care. Whereas palliative care, these treatments are used The use is aimed to relieve symptoms of an incurable illness or disease and improve quality of life. It's generally reserved for chronic, serious, or life-threatening illnesses that severely impact an individual's quality of life. The goal of palliative care is to prevent and relieve suffering. Examples of palliative care include treatment with pain medications, treatment for depression or anxiety, help with meal preparation or shopping, and other types of assistance. Individuals in palliative care typically have more access to necessary pain management treatments and services than those who are in curative care. For example, individuals in palliative care are generally exempt from federal guidelines of recommended maximum opioid dosages. Individuals who are unsure about whether or not they should be receiving curative care or palliative care should consult their physicians to help with the decision-making process. So if your loved one has a serious illness and you're feeling stretched thin, ask for palliative care. It's not about giving up. It's about getting more support. Now, let me highlight a few things that caregivers often miss. Medicare does not cover 24/7 custodial care. That's private pay. Medicaid are sometimes covered under Medicare Advantage extras. Hospice gives you respite care. Use it. It's not selfish. It's not selfish. It's survival. Bereavement services are for you. Counseling and support groups are part of the hospice benefit, even after your loved one passes. Caregiver training services are new and mainly underused. So ask your loved one's doctor if you can get formal training, even if it's via telehealth. And remember, Medicare Advantage plans and PACE programs, that's the Program of All-Inclusive Care for the Elderly, they may offer much more caregiver support than original Medicare. So, always ask. Now, for personalized local help, you can call the Elder Care Locator at 1-800-677-1116. They'll connect you to respite programs, caregiver support, and even legal aid. I've given you some information today, and maybe you'll need to rewind or replay the segment, but the information is there. I want to leave you with this. Being a caregiver is hard, but you don't have to do it alone. Medicare has built-in support through home health, through hospice, and palliative care. They may not replace you, but they can hold you up. So today, if you've been wondering about hospice, call a hospice agency and just ask. If you've been struggling with your loved one's symptoms, ask for palliative care. And if you're overwhelmed by the caregiver or Medicare maze, call SHIP or Elder Care Locator. Ladies and gentlemen, this has been the Caregivers Collective. I'm Tangela, once again reminding you that you are not alone. You are seen, and you are stronger than you know. I know it because I feel it every day. Every time I talk about my mother, it brings tears to my eyes, and maybe it does to you, but you get up and you keep going. So I know that you are stronger than you know. So until next time, take care of yourself so that you can keep taking care of them. And of course, don't forget to like, subscribe, follow, and share so that you'll always be notified when we bring you new and updated information. Thanks again for hanging out with us here at the Caregivers Collective.